How are you doing? You are okay now?
All well, Excellency. All well, Excellency. Pleasure. Thank you very much. Thank you very much. So, Excellency, I would like to introduce our co-guests and, in a way, the co-hosts. We have with us Miss Jyotsna Bedi. Jyotsna Bedi is a very, very senior journalist, and she's working as the chief anchor with one of the leading English media house. We have Mr. Amitabh Chiranjeev, who served at the Prime Minister's office as the media advisor. We have a very young and a dynamic media professional, Madam Dhanashree Bonde. And we would be joined by Mr. Abhishek Jha from DD News and Mr. Sidhant from WION. So first of all, on behalf of the Confederation of Young Leaders, the Institute, and the Policy Chronicle, I welcome you for this interactive conversation on how Denmark is helping India to combat the second wave of the COVID-19 virus. And on behalf of several thousands youth, I convey my deepest appreciation, deepest solidarity with the government and the Embassy of Denmark for helping India amidst the unprecedented wave of COVID-19. So please accept my heartfelt gratitude for all the support that you have given to the government and the people of India. With these words, I invite Madam Jyotsna Bedi to please take the conversation forward.
Please. Okay, I'm ready. And I hope to be introduced as young and a leader.
Wonderful. Yes.
Oh, wow. That's wonderful. Thank you so much, Mr. Suwan, for these warm words. And I once again welcome His Excellency, the Danish Ambassador, Mr. Freddy Svane. And I'm sure that this conversation will definitely strengthen the bond of solidarity at large. And like everybody knows, Mr. Freddy, that Denmark and India have been maintaining cordial and friendly relationships since many years. We have just signed a Green Strategic Partnership Agreement also. And we are working together on every field, be it academic, be it research, be it economic, and so on. So I once again welcome you, Mr. Freddy Svane.
Yes,
and it's like we are facing the unprecedented COVID crisis, Mr. Freddy, unfortunately. So my first question to you is with this, that what kind of assistance Denmark is providing to India, and what does the shipment consist of, Mr. Freddy? Over to you.
Thank you very much indeed, and happy to be invited. And of course, I would like to express on my behalf, and of course the Embassy's behalf and Denmark's behalf, our sympathy to all those in India suffering, having suffered, lost precious lives and so forth. Of course, this is an unprecedented crisis. It's unprecedented. And when you saw how kind of explosion in the infections that hit first and foremost in Maharashtra and then was crossing over, it's definitely a wildfire. And, there's a lot of blame gaming going on. I think what is important is we stand by the people of India, that we stand by India. And in that context, of course, Denmark is responding, has been responding, and will be responding to whatever request, whatever kind of appeal might come from the Indian side. I think I will put it into three tracks. First and foremost, government to government. And the Indian government approached the EU, and the European Union have a special mechanism called the Civil Protection Mechanism. And we have also, let's say, responded to that. And that brought a number of ventilators to India. On top of that, we have also the government. We have allocated funds to the Indian Red Cross, so the Indian Red Cross can purchase whatever is needed here. It could be beds, whatever, ventilators and so forth. Secondly, and then we have also donated money to different international organizations working here in India. The second track, which I also think is extremely important, is, of course, the private sector. And we have many Danish companies operating in India, and they are also taking care of their staff. A company like Maersk have more than 10,000 people here. And you should not overlook the fact that private companies across India, whether they are from Denmark or Germany, wherever they come from, they take care of their staff. Most of them, at least I hope, but all the Danish will do. So they take care of their staff. I know they are bringing in oxygen concentrators. They are bringing in their what kind of medicine needed and so forth. So they're doing, in fact, what we all would like to do, namely to help those who are dependent on us. The third track, if I may, is of course the solidarity that we will express and that we have already conveyed to the Indian government, the Prime Minister of India, Modi, the foreign ministers. So our ministers have expressed their solidarity with India. And of course, also made it very clear that we are ready to help India by all means and whenever it's possible and so forth. So these are the three main tracks. And if you allow me to highlight one thing, which I think is really far-reaching, we have a company called Novo Nordisk, and they are owned by a trust. They're into insulin treatment. They're also a treatment. They're also very, very big in India. But the trust behind, they granted their 10 million kroner, Danish kroner, which equals close to 2 crores Indian rupees. And that has been granted to a special, the office, through the office of the principal scientific advisor, in order to set up emergency hospitals, or one in Jharkhand and one in Faridabad, and 4 mobile hospitals. And that's really what is needed. It's not just solving today's problems. It's also about building up concepts, building up new innovative solutions that can help India, and especially the rural part of India, while this wildfire is still sweeping the subcontinent of India.
Okay. So Mr. Freddy, Amitabh Ji with us. He's a senior journalist, and Dhanashree with us. She's a media professional. Amitabh Ji, over to you. You may ask the question.
Yeah. Good afternoon, Excellency. My name is Amitabh. And my question to you, sir, is what is the reaction when Denmark sent 53 ventilators to India? I mean, what is the reaction from Government of India and especially Ministry of External Affairs?
I mean, when we decided to donate based on the international appeal through the European mechanism, then of course we were looking to what could we donate and what was really needed. And I must say that the Ministry of External Affairs has been extremely supportive, and we all know that it were down with the COVID, many of the officers, so it is not an easy task. But as soon as we had identified what we would like to donate to India, I think the Indian authorities worked very professionally, and they were extremely helpful, being, of course, the Ministry of External Affairs, but also the Ministry of Health. So I think it's been really organized smoothly, at least what we see. And I went to the airport to receive it. It's not for doing public diplomacy, but it also, more importantly, to send the message towards India and all you, the Indians, that we stand with you. And it's not the number which is important here, it's the gesture which is important. So I think it has been praised, and we are following it where it ends up these ventilators, and through the good office of the Ministry of External Affairs. So I think, given the circumstances, very supportive.
Thank you. I mean, the next question is, what is the role of government, Denmark government? How did he cope up with this COVID? Could you please explain a little bit so that Indians could also be able to?
Yes, thank you very much. I think it's a very important question, which of course we have to ask in all our societies, whether we are a small country or big country, we are well developed or less developed. How do you respond, and how did you respond? And in Denmark, we did more or less like India did during the first wave. We also locked down 11th of March, a very kind of stringent, strict lockdown. And we did exactly what you're doing, did out here, mask or sanitizing, containment, and shop stores, or restaurants, hotels, whatever, department stores closed down. Then we opened up gradually because the numbers decreased quite rapidly, and it became summer. And summer in Denmark is not the summer in Indian context, but Danes more after depressing winters, they want to get out. So the cafes were full of people, and youngsters were roaming around, and everybody thought now we were over this first wave at least. And then it came back in October, November, and I myself was back in Denmark in December and January, and there we had the second lockdown, and that has been extended quite until quite recently, and now we are in fact opening up. Basically, there are very, very few restrictions left. But we did exactly the same: containment, lockdowns, closing of stores. So really to avoid too much of infection being spread. And of course, we were always telling people to wear masks. It was mandatory and so forth. So, and today we have what we call a micro containment zone. So there are different indicators that will show if the number of incidents or the number of infected people, if that is crossing a certain threshold measured per 100,000, 1 lakh, then the very specific small area will be closed down. So I think it's more or less the same, but we also have to keep in mind that we did not see anywhere near the numbers and at the speed at which you were faced with the second wave here in India. So it's a different ball game, of course.
Yeah.
That means lockdown is the key word for the success, right?
So I didn't get that. Sorry, could you repeat?
Lockdown in your country is very important to curb the COVID coronas, you know.
Yeah, I mean, what is important, and I think the most important thing is to wear the mask.
Yeah, the mask is of course there.
That's the most important thing. And, you know, I'm not, personally, I have the view that you can't ask your government, whether it's a Danish government or an Indian government, wherever you are living and whatever kind of nationality you have, you can't just expect a government to keep out the virus. Flu is coming regularly every fall, and then we take a vaccination and so forth. So each and every of us, we have an individual responsibility. And I tell you, I live very close, just across the Lodi Garden. And I'm doing normally my morning walks and evening walks. Now it's closed, unfortunately, but that's how it is. But I was so surprised to see how many people were not using masks, even though it was mandatory, and even though there were a lot of signs advising people to do X, Y, Z of things, but they didn't do that. So now they are in fact paying the price. It's not the same as saying that others could have done more. Of course, others authorities could have done more, no doubt about that. But it also boils down to the individual responsibility. You have to take responsibility.
Yeah.
Thank you, Excellency. Back to Jyotsna, please.
His Excellency, like we, the people of India, government of India never expected the second wave of COVID crisis, right? So how do you see the Indian government response to the second wave of COVID-19?
I think, as I said before, that when we started sensing that the numbers were increasing quite drastically in Maharashtra, I think we were all taken by surprise. I mean, we also made reports regularly, almost on a weekly basis, to Copenhagen about the COVID situation here, there, and everywhere. And nobody, at least based on the exchanges we normally have with experts from the government side and experts that are independent, nobody really foresaw a second wave, at least to the tune or to the dimension of what we have seen. So that's a different thing. And I'm pretty sure you will have a lot of reports, you will have a lot of discussions, because a lot of Indians, you have suffered, you have lost your loved ones, and And I also know a lot of people and that have lost their life, and it's so heartbreaking. Question, of course, will be, could it have been avoided? Perhaps, I don't know. I'm just reflecting as to why did India face that? And one thing which is important to keep in mind, that you need to invest in your health sector. But you can't build up a health sector by 1 year or 2 years or 3 years. It takes a lot of efforts. And I come from a welfare society, and we have free healthcare. I can go to whatever hospital I would like, but it has taken many, many years to build up that capacity and that infrastructure. So the point being that you, as a society, you need to invest in your health sector, and you can't do it. And if I look back to how India emerged from independence and so forth, facing a lot of challenges, of course, as to development and even hunger and all that. I think the basic conclusion, very simple conclusion, is that there was not invested sufficiently in building up the health infrastructure. But it's not something that can be done overnight. It's impossible.
Right. Thanks very much for your support and cooperation to India. Thanks for your suggestions also. Are we expecting some more assistance in coming future?
What is there? We are constantly looking into how can we help India based on the request and appeals. So we are constantly evaluating that. I'm in the coming days, what is called the Indian Danish Chamber of Commerce in Denmark, IDCC. They have raised money, so they have acquired quite a big number of oxygen concentrators, and I think as we speak, they might be on the way to India, and I hope to go to the airport to receive them. But that is a private initiative. That's all the corporates. It's Danish companies are having interest in India, operating in India, creating jobs in India, adding to the success of India. And on the other hand, also Indian companies operating in Denmark. And one company which you already know about is Larsen & Toubro, LNT, and they have been spearheading that. And the solidarity comes from each and every corner of the society, whether it's individuals who are donating money, individuals who are acquiring these oxygen generator or concentrators, and then the private businesses and the government business. I think this is a holistic sign of solidarity, because what you are facing can easily come to other countries. So, and to start with, India started exporting vaccines through COVAX, but also bilaterally. And I know that a lot of criticism of that, and that's of course also a political issue here. But I think India did what we are now helping India in kind of return. Despite the fact that you have a huge population, you have a huge need, you stand you stood with the world at that time, ensuring that humanity is beyond borders. And I think one takeaway from this very, very devastating pandemic is the following, namely, it calls for international cooperation. Today, too many countries are sitting behind their borders, and me first, my country first, and so forth. And nobody is to be blamed, because that's how you normally will react. But the call for international cooperation, whether it's vaccines, whether it's other issues or devices, practices, and so forth, is so important. So international cooperation is the answer to a lot of these issues that now India is dealing with. Nepal is coming, Bangladesh is coming, and I'm pretty sure it will be spreading, unfortunately, to many other countries.
His Excellency Dhanashree with us. She's a media professional. Dhanashree, you please come in and you please ask the question.
Yes, ma'am. Good afternoon, sir.
Good afternoon. I can't hear you. Speak a little bit louder.
Yes. Am I audible now?
Yeah, fantastic.
My question to you is, given the ongoing scenarios in accordance to the pandemic, focusing on the present health environment and conditions is only basic to the situation. However, what measures could we take in order to improve the health security agendas in the coming future, given the flourishing bilateral terms and ideations?
Is that the question?
Yes, yes, sir.
Yeah. But I agree totally. I mean, this is the main conclusion of what we have seen. That's a lesson that you have to draw from all that. You need to invest in the health sector, no doubt about that. But of course, you can't have 1.3 million or 1.3 billion hospital beds. Nobody can afford that. Nobody should afford that. So it calls for a holistic health strategy, how to improve the public health. And this, as I said, based on our experiences and my own personal experiences, it takes a lot of time. And we have to realize and understand that the pandemic is global, and therefore the response, the proper response to the pandemic is international cooperation. So important. But you need to create a far better public health system. It's not only India, you will see many, many other places, and even in Denmark. When I was in Denmark during December, January, we came very, very close to our capacity. And we are really a rich country. We are one of the most elaborated welfare societies in the world. And yet we also came close to the capacity of beds for COVID patients. So it shows that regardless of where you are on the development ladder, of course, our scale means a lot here, but we will all be put under pressure, and we saw that in Denmark as well. So cooperation, investment, and kind of global outlook, very, very important.
Thank you so much.
His Excellency, I would like to go back to the private players and non-governmental organization. Are you looking to expand the framework of cooperation by aiding them, by aiding private players, by aiding non-governmental organizations, that is NGOs, or it would be remain on the government level?
No. We believe in kind of multi-layered response, and we are not telling private companies what to do. We are urging them and telling them through our Indo-Danish Business Association, which is encompassing all our companies operating in India, as well as IDDC, I spoke about earlier, which is located in Denmark, the big business associations like DI, which is like a CII of India and so forth, and Danish Chamber of Commerce. But we are telling these different business associations and companies, we are trying to tell them about the situation in India and the need for assisting India. And we're not talking about development assistance. We are just reciprocating what you did early on with the vaccines and so forth. And I think it's important to keep in mind. So it's for the companies to decide how they will use the money that they will set aside. I'll give you another example, Lego, the very famous toy company, they just donated $1 million to Save the Children, the Indian affiliate of the international NGO called Save the Children. And why did they do that? Because they know, and we know, that the children are perhaps the most vulnerable. They might lose their parents, they might be living in under very dire conditions and so forth. But the kids, whether they're from rich family, affluent families, or homeless, they are part of our future. So by donating $1 million to Save the Children, then they will also help and bring kind of relief to children across India. So I think it's important. So the multi-layered, the multi-focused approach is what we would like to see.
Amitabh is still with us. Amitabh ji, you can ask the other question.
Mr. Excellency, I think the punchline of all this conversation we received is the act fast and act with the force.
Right. Yeah, I agree with you. I mean, I think, and you see the European Union or Team Europe has done a fantastic job.
Yes.
And yeah, we are acting, and we are not looking into who is asking, who is not asking, and whom to blame. It's not about that. It's a kind of humanitarian response based on the holistic approach of humanity. And you have very good sayings in India, and we all belong to one big family, and that's a very important approach, which is describing what we in fact are doing. So this is, I think, we need to act, and then somebody can react if they want to, but action is really need of the hour.
Yeah,
I agree with you.
Very fast, actually. Yeah, that just.
His Excellency, my final question to you amidst the unprecedented health crisis would be your message to the people of India, especially the young India.
Yes, very important.
Very, very important. We are all touched day and night seeing all these horrible pictures and images being spread on the social medias about people dying, people not getting access to oxygen and so forth. It's like a wildfire. We saw years back how the wildfire almost devastated large parts of Australia. And it's really, really difficult if it really is a wildfire like the one we see now as to the COVID in India. But trust me, there is a future. And the younger generations, however, how much they might have suffered, family-wise or individually, they are part of what comes after. And the good thing with a wildfire, it's blowing fast and sweeping, and then it's over. But after the fire, there's a strong need to show solidarity, to build up the society. And hopefully there will be a strong quest, even a strong wish among the younger generations, really to be part of the kind of recovering of India, rebuilding India, creating a better responsive India. So India will offer better opportunities to each and every. And my hope is that the vision New India will have a far better kind of platform for becoming a reality. And that's what is important. Access to education, access to health, access to water, access to insurance and whatever. That should be the dream. And I hope that now we have all faced foreigners, Indians living here in India. We have seen with our own eyes how a pandemic can really destroy and devastate a country and perhaps also many minds. And of course, we have to express our sympathy to all those who have lost livelihood and friends and their own life. So my hope, which I like to express, is that the future would be better, stronger, but also more resilient, because this pandemic is not the last one. It's the first one, and we will see many of them. So trust your country, trust yourself. Don't ask for others to rebuild for you. You have to be part of that yourself. So individual responsibility is called for.
Wow, thanks for these lovely words, Mr. Svane. Hope you had your lunch, not getting late because of us.
No. I like to be with young leaders, so it's a great opportunity for me.
Wow, thank you so much. You please come in.
Yeah, Ambassador Freddy is a very dear and esteemed associate of the Confederation of Young Leaders family. And I personally believe that the Indo-Danish relation is at its best under his dynamic tenure. And we recently concluded the India-EU summit. So I think that we came up with major landmark achievements and declarations. I think that once we are in control of the pandemic, we could utilize more such channels of communication and together build a shared future where we could share the benefits, the good practices, especially in the sector of health, because we realized amidst the pandemic that health is everything. So I think that India, EU, and obviously India, Denmark could be a good leading example, a good light to shed upon that how could the two great powers could coordinate and collaborate together to create a community with a shared future. So on this very optimistic note, Excellency, thank you once again for your...
I have to respond to that because,
Please.
come on, it's very important. The EU-India summit that was concluded just recently is the most successful summit ever between the two major democratic blocs of the world. You have India, world's largest democracy, and you have EU. So the world's two largest democratic blocs agreed to a huge number of activities and actions that will be taken. And what is interesting is that there was a full alignment of all the principles and the priorities of India and EU. And now we have a firm setting in a global context of shared values, believing in democracy, believing in the rule of law, and so forth. So this is a brand new kind of elevation of our relationship to an even higher level. That is a huge commitment undertaken by your Honorable Prime Minister and India, as well as the European Union and the European member states, including Denmark. So we hope that action is not just words printed in papers, but it's also a plan for true, genuine action. And I'm pretty sure this was a kind of watershed moment, and that will take us to a higher level, and that will bring stability to the whole world, and also when it comes to the health. Very important.
Definitely. I think it is the first leap towards the larger leaps that need to be taken to promote the India-EU cooperation at large. So thank you very much, Excellency, and please stay safe. And I look forward to meeting you as soon as possible once the pandemic and the travel restrictions are eased out. Thank you very much. Thank you very much.
Thank you very much. It was indeed a great honor. And thank you really for moderating and securing this. And very good questions or answers, extremely good as well. Thank you very much.
Pleasure, Excellency. Thank you. Thank you, Jyotsna Bedi.
Thank you.
Thank you.